Hi, how are you? ¿Cómo se va? ¿Cómo estás? That's how you say how are you in multiple different languages. Do I speak multiple different languages? No, I do not. But it is important to understand, be willing to adapt, be willing to learn, and be willing to kind of take ourselves out of our normal approaches to make others feel more comfortable and to communicate more appropriately. I am not a translator. I know very, very little Spanish, French, sign language. I can't tell you how many people I've come across that we may not be on the same communication waveform when it comes to education level. Sometimes I am speaking too high of a level. Sometimes I cannot keep up. They are speaking way above my level. However, we're still communicating. We're still trying to understand each other. And in nursing, in medicine, communication is key. And that's what we're going to talk about today. One of the nursing core values, communication. I'm pretty sure we've talked about this in probably more than one of my videos in the past because I find it so important. I could probably talk about it for way more than 5 minutes, but I'm going to try to keep it nice and short and brief. If you cannot communicate with your peers, your management, your providers, your association, you cannot thrive in the business. Communication is important for you to be heard, for you to understand, for you to adapt and change. And like we've talked about before, medicine is always changing. We have to be willing to adapt. We have to be able to learn. We have to be able to talk about what we've done wrong, what we've done right, what we need to work on, what we've been through so that we can get through what we're going through now, and be willing to communicate about what we can do to make positive change. Now, aside from your management and all the other things that we just talked about, you have to be able to communicate with your patients. You have to be willing to speak and educate your patients. I see people discharging patients all the time and just handing them papers and saying, bye. You can't. You have to communicate. You have to make sure that they understand why they're here, what they're getting done to them while they're here, what medicines they're getting or changing or not taking anymore. Why? You have to be able to communicate in a way that they understand. We always say 6th grade level, bring it down to a 6th grade level. When you're with your patient, if you're getting that vibe that 6th grade is too high of an education, you got to bring it down. Maybe it's too low when they're getting bored with the conversation. You have to find a way to communicate. You have to be able to read the room and communicate appropriately. Now, I said, how are you in a few different languages when we started. Again, I don't speak those languages. I can't. Very minimal. But there are translator devices so that we can communicate in proper channels with our patients. Because I don't know about you guys, I don't know about where you work, but where I work, I have come in at least 3 languages, Mandarin, Japanese, and Spanish, that did not speak English. So you have to know where you can go and what resources you have so that you can communicate appropriately, because we've learned many times you cannot always rely on a family member. In fact, you're not supposed to. So communication has been and always will be, in my opinion, the most important, but definitely an important role in our job as a healthcare provider. Admission, during their visit, and especially that discharge, if we don't communicate appropriately, we can cause serious, life-threatening harm. So I hope and pray that as like a preceptor or a veteran nurse, and as somebody who wants the medicine world to grow and change in a positive manner, that we are teaching our young, our new grads, our new into the medicine world, how to appropriately communicate. Because again, if we don't, we are not going to be able to thrive in the business. We're not going to be able to help people, and we're going to cause potential harm. I hope so much that this was understandable and that it was clear. And if you're wondering how in the world I was able to do that, simple Google search. There are apps on our phones. There are so many ways to kind of do easy little pieces of communication help, and technology is so plentiful for us to be able to just kind of make our patients more comfortable with a little bit of a salutation, such as, hi, how are you? Hope you guys enjoyed my video. You have a good evening. Bye.